So my name is Amyn Haji. I'm the Director of Surgery here at King's College Hospital in London. I've also been in interventional endoscopy for the past 11 years here, and we set up the interventional endoscopy service primarily for lower GI, but our interest is mainly in minimally accessed surgery and endoluminal surgery, but for treatment of colorectal cancer, early colorectal cancer in particular, and complex polyps. So our main interest is primarily with the early diagnosis, using sort of magnification endoscopy and artificial intelligence to assess these polyps, and also treatment of these polyps, and using new technologies, particularly to look at advanced colorectal cancer and locally advanced cancer, how we can actually reduce the need for having more major surgery. So I think, it's been really interesting working with Mirai Medical and the EndoVE probe, in particular because we see many patients in our practice that have locally advanced colorectal cancer. And currently the treatment modalities can be quite long-winded. So if patients are not fit, for example, to have surgery, they can have chemoradiation only if it's rectal cancer. But if it's colonic cancer, we are rather limited in terms of what we can do. Some of them can have neoadjuvant chemotherapy to cause a local reduction in their tumor size and tumor bulk. But primarily we have to just palliate their symptoms. And you often have to wait for these patients to get obstructed, and then you offer them a colorectal stent to prevent them having obstruction and major surgery. So what's interesting about this technology is that we can utilize the technology with EndoVE to treat patients with locally advanced cancer. Treat them before they get obstructed in order to avoid that obstruction and that emergency admission to hospital, and also treat these patients to palliate their symptoms in terms of reducing their tumor bulk and reducing some of the local symptoms that these patients get. That might be bleeding, or maybe mucus discharge, or tenesmus, or urgency, or pain. So I think it's very interesting, and I'm really looking forward to using it more in the future. So I was introduced to the Mirai product with EndoVE a couple of years ago, and we've been using it now at King's College Hospital routinely in our practice in our multidisciplinary meeting. We have now have a partnership with our oncologists and also our radiologists, so we identify which patients would benefit from this treatment, and then we would offer them the treatment in endoscopy. So the treatment is actually provided by us as endoscopists, interventional endoscopists, with local treatment during the same procedure as they would come for their colonoscopy. So it doesn't often involve any additional procedures to be undertaken. You can assess the polyp or the tumor in question during your index colonoscopy, and then you can go ahead and treat this patient if they're suitable at the same time. The EndoVE probe has many benefits, but I think one that's very interesting for us is the ease of application. Because a lot of different technologies, sometimes it's quite difficult to apply that technology to treat the tumor and reduce tumor bulk. So from my perspective, it's just the ease of access, the comfort of the patient that actually during the procedure, it takes just a few minutes to actually apply the product and use the technology, which is a huge advantage. Patients can be treated without sedation in the majority of cases, or a minimal amount of sedation and analgesia. So that's very interesting because it doesn't really involve a huge burden for patients, particularly these patients are elderly, or they have locally advanced or more advanced cancer. They don't want to make many trips to the hospital and have very invasive procedures. That's a completely different scenario if we go down to, say, using a colorectal stent for patients, because they would need to have anesthesia, they would need to have combined radiology support as well as interventional endoscopy support. So from my perspective, I think the ease of access and having a single user like an endoscopist to supply the treatment is the most interesting. I think the only thing to add really about additional bits about user experience is that training is fairly straightforward for getting new endoscopists on board. You need to be an interventional endoscopist to use a product, of course, to apply the technology. But actually, it's very easy to train endoscopists to do it It doesn't require a long training program. It really requires them to observe a procedure and then go on and do the procedure if they're an interventional endoscopist. So from that perspective, that user experience and the interaction is very easy to apply, and this can grow quite quickly in our field. I think in terms of our main practice is really treating sort of early cancer and complex polyps, but we have a bit of a dilemma, particularly in treating rectal cancer patients that are symptomatic but are not suitable for any surgical treatment because they're not fit, and also these patients, when they do obstruct, they're not suitable for stent because you can't really apply a colorectal stent in the rectum. So in our daily practice, actually, that is the most interesting because we can treat patients with rectal cancer fairly easily because access is easy with the device and an EndoVE product in the rectum, and you can improve their symptoms because they often have a lot of local symptoms such as pain and urgency and discharge, and also hopefully you can prevent them getting obstruction, thereby avoiding the need of having a stoma or having emergency surgery, which is what they don't need when we're palliating symptoms and they want to be with their families at home and have palliative care rather than spend time in hospital. So from day-to-day experience, I think that's the most advantageous. I think experienced doctors, I think when we showed the product at our live meeting last year, we had a huge interest from a lot of our experienced interventional endoscopists and also from oncologists, because at the moment there aren't that many options for patients, particularly for locally advanced cancer. So I think experienced doctors should have this on the shelf, to have this as a modality that's available in case they need to use it. So if it's available for you in your hospital and it's on the shelf, then you can easily use this technology and apply it when it's needed for the benefit of patients. So currently for using EndoVE, we tend to select patients with locally advanced cancer in the colon or in the rectum. It doesn't really matter where you are in the colon because you can access the tumour the same way you can access it through an endoscope. And that's what the great advantage is really of EndoVE treatment, is you can access the tumour even higher up, away from the rectum. So currently we tend to choose patients that are either symptomatic with their tumour, or they've refused treatment, or they're not fit for surgery. Then we would treat them even if they're not symptomatic to try and avoid any further obstruction or any other symptoms. And of course, if patients do have local symptoms, then we would treat them and perhaps have repeat treatment at shorter frequencies, such as at 2 to 3 month basis. I think in terms of the learning curve for EndoVE, I think this is pretty short. If you're an interventional endoscopist and used to doing interventional procedures in the colon or in the upper GI tract, you should be able to use this device fairly easily because it involves the same sort of torque and tip control that you would use during normal endoscopy and during normal interventional endoscopy. So I think whether you're an upper GI or a lower GI endoscopist, that should be fairly straightforward. I think you just need to observe a case, understand the technology, understand its limitations and actually its advantages, and choose the right patients to start. So I think that learning curve is short. My personal opinion would be you just need to observe a case, and then you need to start using the procedure with the support of the company, and the device. I think it'd be good to share actually our experience of one of our patients. One of our patients, she was in her early 90s. She's still actually working as a cleaner in London, and she had locally advanced colonic cancer with symptoms of pain and urgency, diarrhea, difficulty opening her bowels. When we examined her, she didn't have any metastatic disease, but this was a T4 tumour, in a bulky tumour in the left colon. And what we've done with a series of treatments for her, in sequential treatments, we have treated her so that she can carry on working, does not have any further symptoms now, the pain has improved, and she is not obstructed. And the normal journey for that patient, that type of patient, would be to do nothing and just treat with analgesia and wait till they get obstructed in order to put a stent. So I think that's a huge success really for her, and she's delighted with it, and she's written me cards and letters to say how wonderful it is that she had the opportunity to use EndoVE and use this technology. So I think that's really rewarding, and I would encourage people to sort of to do trial the product because it would be useful, particularly for patients like this.